Management's one bag per week service.
Indiana in the Morning, presented by First Commonwealth Bank on the Voice of Indiana County, WCCS, 101.1 FM and AM 1160. It's now time for our interview segment presented by Marcus & Mack, a law firm representing injured people. And, of course, the month of May has been Mental Health Awareness Month, and there have been some celebrations going on throughout the community and throughout the nation. Of course, we want to learn more about it, so we are grateful to have with us today psychiatrist Carolyn Menta from Indiana Regional Medical Center. Carolyn, it is good to talk to you this morning about this very serious topic.
Good morning. Thanks for having me.
I'm glad that you're here. So let's talk it out from the big side of it. What is mental health defined as, and who does this affect?
So the broad term of mental health refers to our emotional, our psychological, social, and developmental well-being. Essentially, our mental health, it influences how we think, feel, and act. It impacts how we handle stress, how we relate to others, the choices that we make. Mental health affects everyone, from toddlers on up to the elderly.
You would never expect it, though, to affect somebody as young as the age of a toddler, but it does. I mean, there's a lot of emotional impact even at that very early age.
Well, absolutely, and one of the things we're looking at in toddlers would be their cognitive and social development. Are they meeting those developmental milestones on time? And if not, how do we help them along so that they can catch up to where they need to be?
Aside from the milestones that you mentioned, and we'll open this up again to the broader sense, what are some common indicators that somebody might have a mental illness?
I would say some common indicators that someone needs to take a look at their mental health would include persistently low mood, low motivation, feeling anxious or worried, even if you can't identify a reason why, if there's no situation going on in your life why that you're feeling anxious, difficulty falling asleep or staying asleep, changes in appetite, decreased productivity, or ongoing difficulty with relationships. Those would be the most common things that we see.
Are mental health problems hereditary? Like, can they be passed down from one family's generation to the next?
Sometimes there can be a genetic component with a mental health issue, but not always. And even though some mental health issues may have a genetic component that makes you more likely to develop them, there's plenty that people can do to maintain good mental health and avoid those problems really blossoming into full-blown mental illness. So first and foremost, you want to really protect your what we call your me time, and make sure that you use it. It's so important that we all have time to wind down and regenerate on a regular basis. It's important we practice healthy coping in the face of, an ever-present stress in our lives. So people need to exercise regularly, spend time with positive social supports, take time to do those activities that you find relaxing, calming, uplifting. Practicing healthy coping, taking care of yourself mentally and emotionally can go such a long way toward preventing a mental health issue from developing.
I know this may sound a little weird, but I was just hearing those pieces of advice, I was reminded because of the fact that we had 143 Day from Mr. Rogers earlier this week. I was reminded of one of the songs that he did. It was "What Do You Do with the Mad That You Feel?" So I guess that would be right. That would be a good part in playing that towards the mental health issues as well, and how people can cope and live with a mental health issue.
Oh, absolutely. Absolutely. Having a mental health issue is not the end of the world. It's all in how you deal with it and how you deal with those emotions. But for people who, find themselves with a mental health issue and they need to cope with it, engaging in mental health treatment can help tremendously. They can talk with a therapist, and a therapist can help manage the symptoms and help them to make changes in how they think and act, which can lead to huge improvement in how they feel. In addition, there are medications that are available to help manage symptoms. It can be extremely helpful to work with a prescriber who specializes in mental health treatment.
All right, and what are let's ask about this. What are some resources that are available here in Indiana County?
We are blessed with a number of excellent providers here in Indiana County. I would encourage people to reach out to neuropsychiatric associates at IRMC. If someone is struggling to find a provider, they can also call 211, the information line, and they can help them find an appropriate provider that would suit their needs. And finally, if someone's nervous about reaching out to a therapist or a psychiatrist, they can just talk with their primary care physician, and their primary care doctor can help them with getting connected to the appropriate provider. So there are a lot of avenues that people can follow.
I'm sorry about that. We're talking this morning with Carolyn Menta, who is a psychiatrist at the Indiana Regional Medical Center, and we're talking about mental health awareness, what people can do to help themselves and possibly help out their loved ones as well. So, Carolyn, what does one do if they're worried about their own mental health or maybe the mental health of a loved one, somebody that they live with or one of their relations? What can people do to help out in this situation?
Mm-hmm. I would say the best thing to do, if you notice a change in yours or in a loved one's mood or behavior, the best thing to do is talk with a therapist and get an evaluation. Now, if it's a loved one, you can certainly express your concern to them and let them know that, there is help available and encourage them to seek that help. Once people talk with a therapist, from there the therapist can help them decide if a referral for medication would be necessary. And again, if folks are nervous about talking with a therapist, they can also mention it to their primary care physician that they're concerned, and they can help them connect with an appropriate provider as well.
I actually have heard of primary care physicians asking a lot of questions concerning mental health, so it's got to be gratifying to know that this is expanded into not just the specialized form, but into the general practice of medicine.
Absolutely. We're getting more and more knowledgeable, and people are understanding more and more about mental health, and physicians are more routinely doing screenings and referring for appropriate help. So it's great to see.
These are very stressful times that we're living in. I mean, we've gone through the pandemic, and obviously there are a lot of issues today, what with inflation and, of course, the recent events that happened in Texas. A lot of things can actually become triggers for psychological events, I would imagine. So how has the pandemic or any of these kind of recent issues worsened mental health, if you think it has?
Oh, my goodness. We've definitely seen an increase in terms of people seeking mental health treatment through the course of the pandemic and with recent world events. The pandemic, for instance, has created a lot of mental health challenges. People were very, very isolated in the beginning when we were on lockdown. That isolation led to a lot of depression. People also struggled with a lot of anxiety about contracting the virus or their loved ones contracting the virus, wondering whether they were going to keep their job, how they were going to make their rent payments, finding child care if they weren't able to work from home. Many people had to adjust to working remotely and working at home, which also presents a challenge for a lot of people in terms of sustaining attention and focus throughout the day. I had a lot of people coming in and telling me, I just can't stay focused on my work. I'm so distracted at home. So, working from home wasn't for everyone, but there is help available, again, to help people cope with all of that stress and anxiety. And again, we're very blessed in Indiana County to have a lot of great providers.
What is the biggest what is the biggest hurdle that I think would prevent people from getting the mental health treatment that they need?
I think the biggest hurdle is there is a mental health stigma, and I think while that is improving over time as people learn more about mental health, I think that sometimes prevents people from seeking out the help that they need. People somehow feel that it's a weakness or that there's something to be ashamed of if they seek help. But I think it's becoming more and more understood and more accepted that taking care of one's mental health is just as important as taking care of one's physical health.
If somebody wants to get a hold of you or maybe some other mental health services that IRMC offers, you mentioned contacting a few sources earlier, especially the 211 number to be rerouted in that way. But how can they get a hold of you?
Absolutely. They can reach us here at Neuropsychiatric Associates at 724-464-0270, and we would be happy to connect them with the appropriate provider. We have a number of prescribers and therapists.
Dr. Carolyn Menta, thank you very much for joining us this morning on Indiana in the Morning. All the best to you, and this has been a very, very interesting conversation, and we hope that this maybe sparks some more conversation in the near future for those who need the help that need the help with a mental illness. Again, thanks a lot for joining us.
Thank you so much for having me.
All right, Dr. Carolyn Menta, psychiatrist with Indiana Regional Medical Center, joining us today on Indiana in the Morning, presented by First Commonwealth Bank. And our interviews are presented by Marcus & Mack, a law firm representing injured people.